Today on CityLine, no more muffin top. New fat reduction treatments without surgery. That's all coming up right now. Here she is, Tracy Moore.
Welcome back. Well, Samantha was looking for a non-surgical solution to get rid of stubborn fat around her midsection. She went to see Dr. Mulholland at Spa Medica.
My problem areas are my love handles and my lower tummy. I have done probably everything under the sun. I worked out, I have personal trainers, I go to the gym, I've had athletic therapy, aquafit, anything that I could do, I've done it, and I just can't get rid of this stubborn fat.
Samantha is a typical patient we see for non-surgical liposuction. The technologies that kill fat without a procedure. She's fit. She works out, she's dieted, she's exercises, she does all the things she needs to get the shape she wants, but she's got stubborn, localized collections of fat. Let's look at where a non-surgical lipo is going to be targeting. Well, that's good, you wear your workout pants. So this kind of shows the areas that bug you, right? So point to what bugs you. I don't want to guess, you'd show me.
This.
Ah, yes, the pot. That little area of jiggly wiggly fat that bugs you. What you're seeing today is our patient getting sculpture. Why? Because she's quite tiny. Sculpture sits on the skin, doesn't need any suction, and emits heat. It heats the fat just to the point of discomfort so it's comfortable, and then it kills it. Samantha, there you are. Good to see you again. Here we are at the end of your journey.
I feel amazing.
Really good, so it's worked for you.
Yeah. During my sculpture procedure, it was intervals of hot air and cold air. So immediately after I was done, it felt a little warm to the touch, not uncomfortable in any way, and I was swollen for about a week. I saw results about 4 weeks after, which is amazing.
I can see a visible difference.
Right?
It's not that all the fat is gone, it's just that pinchable fat is much less. So now I can pinch about an inch. I used to be able to pinch about 3 inches. And just maintain your normal healthy fitness and lifestyle.
Absolutely.
And I think you'll be having many beach vacations.
Yes, I think so too.
Okay.
Thank you so much.
Very good. Dr. Steve Mulholland joins me now in studio. Give him some love. Pretty cool. So Samantha saw results in just 4 weeks. Apparently no downtime. So could she go right back to work after having that done?
You absolutely can. Our non-surgical lipo program, which are devices devoted to killing fat, really have no downtime associated with them. You go right back to your activities. Okay. But it's important to note, like as we were discussing during the actual tape, she got a noticeable result, but it's not lipo. It's not liposuction.
Right.
And so if you really aren't adverse to a little bit of a procedure with some recovery, some downtime, some pain, some bruising, liposuction is still your best. What's really cool now is that we do offer 4 or 5 different technologies. This is the sculpture, where we can make a good 1 to 2 inch pinchable difference without any risk, without any downtime. And that's the kind of neat thing now, that if you've done your diet, done your exercise, you've done what you want, you can't really exercise a pot away usually.
Yeah.
Or certain areas like hereditary saddlebags or inner thighs or the love handle. You lose the weight off the breast and face, but not where you want to target it. This is targeted, localized, non-surgical, predictable fat destruction. It's not like the old days. This fat is dead.
So can she go back now and get something else done?
Yes.
How long does she have to wait?
Usually we do 2 treatments 6 weeks apart, then we wait.
Yeah.
And then if we use heating to get the initial result, we might cool the fat the next time. If we cool it, we might ultrasound it. And so, you know, we can do some pretty significant non-invasive contouring now on unwanted body fat.
Okay, that's very interesting. How long does the treatment actually take every time she goes?
Each area takes 20 minutes.
Okay.
So the pot, 20 minutes. Love handle, 20 minutes. Outer thigh, 20 minutes. There is 80% of all treatment zones done in 1 hour.
Okay, very good. Now, will that fat come back?
It's a great question. In the old days, we could shrink the fat cell, but the moment you just sniffed a Chardonnay, boom, it would all come back. Nowadays, the fat is dead. We kill it safely.
Okay.
There's no risk to heart disease or strokes. Your body mops up that fat, takes it to your liver, and you basically poop it out. And so it is safely managed by your body's own waste disposable mechanisms, and there's no risk at all. We're doing such a modest amount of fat each time, there's no challenge. Just like weight loss, there's no challenge to heart disease and strokes.
But you have to make sure, like, she's actually a fit person. She'd have to make sure she stays within the same realm of her diet and fitness regime.
Yeah, I do warn them, if you put on weight,
Yeah.
the fat that's left behind will swell again, or it may go elsewhere.
Yeah.
And it's important, it's not a substitute for getting in shape. Now, let's say you're more full-figured, a full-figured gal, you've done your best, you've gotten down to the weight you're happy with. You don't have to be like a skinny mini. You can be a plus-size figured person and just say, you know what, this one roll really bugs me, or this bra line bugs me.
Right.
And I know I'm always going to be plus figured, but I want the roll gone. So this is a treatment of centimeters, not pounds.
Got
of
it.
Centimeters, not pounds.
Okay,
and it works
I
on
love
guys
that.
too. And guys.
And there were some guys too.
Yeah, we have love handles most commonly.
Yes. Okay, I've got some questions from viewers, and this one came in from Callie on Facebook. She says, I have excess fat around my tummy and bra line even though I exercise. Is there a treatment that targets those areas? You mentioned those areas.
Yeah, so there are about 4 or 5 good technologies available across North America, both in the US and in Canada, that kill fat. And most women want to kill fat. And they're all comfortable and non-invasive. You saw one, Sculpture, today. We've got Cool Sculpting. That's been around for 6 or 7 years. That's cooling the fat, whereas Sculpture heats it cools. So she can treat her bra line, her hips with that.
Yeah.
There's also Body Effects, which is suction coupled, and it emits electroporation or electrical energy. That will kill fat.
Okay.
And then we can use ultrasound waves. You're looking at Body Effects right now. And we can use ultrasound waves called UltraShape. And so, because I'm a big fan of non-surgical lipo, I have all 4, and we can just mix and match and switch depending what works with your system. Almost every aesthetic clinic in North America will have one of those 4 technologies, and they all work on those areas.
So this guy has brought Skin Medica Hydrating Complex Vivier Serum and a $250 gift certificate for all of you.